the first major point I'd really like to make is that infertility is a very common problem. It even happens to women who've had a baby. They can have secondary infertility. And so the first thing to know that if you don't get pregnant within about a year of having regular sexual intercourse 2 or 3 times a week, and you're under age 35, by 12 months, it's time to go at least see your obstetrician gynecologist, and probably within 6 months of that time to see a reproductive endocrinologist. Now, paradoxically, if you're older, if a woman is between 35 to 40, we recommend they go see a physician after about 6 months. And the reason is that fertility is going down between 35 and 40. It's going down all the time, but that's when the rate picks up. And so it's important not to lose as much time, which is why we recommend going after about 6 months. And by the time a woman is about 40, if she's not pregnant within about 3 months, she should go to see a physician. Now, in addition to that, if there's a history that the woman has, for example, if she knows she's had a pelvic infection, or if she had surgery for a ruptured appendix, and so there might be adhesions in the pelvis, or if she has a lot of pelvic pain and might have endometriosis, or if she has irregular menstrual cycles, or if her husband has had the proverbial sports injury, or had a hernia operation, or, has other history of problems that might be difficulty. If there's a history of some kind of problem, or that you think might be a problem, you should go to your doctor right away. Don't wait for a year of trying if there appears to be some problem. So it is important, I think, to note that this is not a journey anybody thinks they're going to have to go on. So you don't want to deny it too long. And the times to move on are at 12 months, even if you're young, and 6 or 3 months if you're older, or if you have any other type of history reproductively, either in yourself or your partner, that could potentially impact your ability to get pregnant. Well, I think one of the most important things is that when women and men are at home now, and we certainly know from just what we're doing right now, there's a huge amount of information out there that, women and men can start to educate themselves about. They don't have to wait for their first doctor's visit to do that. In fact, I would strongly suggest that all women and men, once they hit their adult years, let's just say, by the time they're in their early 20s, they should really start thinking about their reproductive life. Then, when the time comes to go see a physician, generally speaking, most women will see their obstetrician gynecologist, and that's a very good first step. And some of them are more interested and more knowledgeable about fertility than others. And it's very reasonable when the woman goes, or the man goes, to a urologist or his physician, or goes with his wife or his partner to their gynecologist, to ask questions. What do you think about this? How long should we try? What kind of treatment? And when would you refer me to a fertility specialist that's generally called the reproductive endocrinologist and infertility specialist? With a broad brushstroke, depending on how much you'd like to ask, the first step is a good history, and then some very simple tests for the woman and the man, and then a decision about possibly some, simple treatments, and then if there are bigger problems, maybe more specialized treatment.